Understanding zoonotic risks to stay safe. Before we can understand what zoonotic risks are, we need to understand what zoonoses are and why they occur. Zoonoses are a particular type of infectious disease that can affect animals and humans. They can be caused by bacteria, viruses, parasites, or even prions, such as the one responsible for mad cow disease. Zoonoses can be transmitted from animals to animals of the same species. Or they can be transmitted from animals to animals of different species. But more importantly, zoonoses can be transmitted from animals to humans and from humans to animals. Some zoonoses are well known and some are unknown and are yet to emerge. Some known zoonoses haven't been seen for a while but re-emerge under certain circumstances or re-emerge in new susceptible species. Additionally, and more importantly for you, horses can also transmit zoonoses to humans. So what exactly are zoonoses? Zoonoses are infectious diseases that can be transmitted between animals and humans. So how are zoonoses transmitted to humans? Zoonoses can be transmitted to humans via different pathways. Zoonoses can be airborne, transmitted from animals to humans via vectors such as mosquitoes and ticks, can be foodborne, or pass on to humans who spend time in close proximity or have direct contact with animals. Zoonoses are transmitted to humans via direct or indirect contact with animals or their byproducts. Can zoonoses be transmitted from human to human? The answer is yes, which means that zoonoses are as much a biosecurity issue as they are a public health problem. In short, if you are exposed to a zoonotic disease and become infected, you could be a source of infection to others at work and the community at large, including your family and friends. So, by protecting yourself from zoonotic risks, you also protect others in the community. Why should you be concerned about equine zoonoses? Aside from the obvious reason being that you work with horses, you need to understand how new equine zoonoses may emerge. For this, we need to look at how humans interact with horses, which is different from how humans interact with other types of animals. Pets, such as cats and dogs, mostly live in the human environment and come in frequent contact with humans. However, these animals do not often come into contact with wildlife or livestock. Here, the overlap between humans, domestic and wildlife animals is not ideal for the emergence of a zoonosis to occur. Humans interact with livestock regularly, but most of these animals live out in the field. On occasion, these animals may come in contact with wildlife. The potential for a zoonosis to emerge is greater in this scenario than the previous one. With horses, it's a very different story, because the human-horse relationship is very much at the crossroads between the relationship humans have with pets and livestock. Horses don't live in people's houses, but humans tend to get as close to their horses as they would with their pets. Horses also live or spend long periods of time in the field where they can come in contact with wildlife carrying zoonoses. Here, the overlap is ideal for new zoonoses to emerge. Hence, humans interacting with horses are at a higher risk of being exposed to a new emerging zoonosis and should be cautious about potential zoonotic risks. A good example of this kind of zoonotic risk emerging through contact with horses is the emergence of Hendra virus in 1994. Hendra virus had probably been circulating in bat colonies for a while when it spilled over into horses and from horses to humans, with in some cases very dire consequences. To date, 4 people have died of Hendra virus. All of them had closely cared for horses without having taken proper precautions. Why should you be more concerned about equine zoonoses? Because zoonoses are more likely to emerge through horses, putting you at risk of becoming infected. There are many references in the literature that document existing zoonotic risks linked to horses. In Australia, there are a number of known zoonoses that can be transmitted from horses to humans. While some are more common, others have the potential to become an issue for people working with horses. And of course, we have to consider the risk from zoonoses that have not yet emerged. Equine zoonoses can be transmitted via direct contact with horses, via contact with urine, feces, manure, and other bodily or airborne fluids. In your line of work, it is unlikely that you can avoid coming into contact with the horses and potentially contaminated materials. You should inform yourselves about zoonoses because the majority of infectious diseases have an animal origin, including horses. And why should you protect yourself from zoonoses? Zoonoses present a biosecurity risk as they can be transmitted from humans back to animals in your care. Because zoonoses can be transmitted from human to human, they are also a workplace health and safety issue for you, your colleagues, and your clients. Finally, and we often forget about this aspect, is that people working with animals can be a source of zoonoses for others in the community and become the source of a public health problem. You should endeavour to protect yourself from zoonoses in your workplace, as you will also protect your colleagues, clients, but also your equine patients. How can you protect yourself and others from zoonoses? The interviews done within the thoroughbred industry in the region in 2018 cemented the idea that prevention yields the biggest success. The Australian Veterinary Association has made personal biosecurity guidelines available online, which can help you develop your own strategies. If you are unsure about what level of personal protective equipment to use, remember the rule of thumb. If you are conducting a non-invasive procedure on a healthy horse, you should consider wearing gloves, eye or face protection, and a gown or overall. If the horse is healthy, but the procedure is invasive, and you are likely to come into contact with bodily fluids, you should also consider wearing a disposable P2 respirator. If you are dealing with a sick horse, you should consider maximum PPE protection. This also applies if you are dealing with a sick horse displaying Hendra virus-like symptoms and who is not vaccinated against Hendra virus. You can protect yourself and others from zoonotic risks by following personal biosecurity guidelines. To sum up, zoonoses are infectious diseases that can be transmitted to humans from wildlife or domestic animals, including horses. Zoonoses present an uncertain risk to humans, as some are yet to emerge, and you should assume the risk is present at all times. Zoonoses can be transmitted from humans to humans and become a public health issue. Zoonoses can make you mildly, severely, or lethally sick, and medical treatments are not always available. But you can protect yourself and others from zoonotic risks by following personal biosecurity recommendations. Your health matters. Don't get caught out. Keep yourself safe from zoonoses.